Hey everyone, let's talk about something that happens to literally half the population, but somehow still feels like a giant, confusing secret. I'm talking about perimenopause. You've probably heard of menopause, right? The grand finale of your reproductive years. But what about the decade-long warm-up act? That, my friends, is perimenopause, and it can start a lot earlier than you think. Forget what you see in the movies. It's not some switch that flips overnight when you turn 50. For many of us, the journey begins in our late 30s or early 40s. It's this transitional phase where your body starts preparing for menopause. Think of it like puberty in reverse. Your ovaries, which have been the MVPs of your reproductive system, start to wind down their production of estrogen, but it's not a smooth, gentle decline. Oh no, it's more like a roller coaster. This hormonal roller coaster is what causes the classic and sometimes baffling symptoms. The first thing you might notice? Your periods go haywire. They might get shorter, like 2-3 days instead of 5. Or they might get longer and heavier than ever before. You might skip a month, then have 2 cycles back to back. Your trusty 28-day cycle? Suddenly it's more of a guess when it's coming game. It's totally normal, but it can feel really unsettling if you don't know what's happening. And then there are the, power surges. We're talking about hot flashes. You might think those are reserved for full-blown menopause, but they can definitely start during perimenopause. You're sitting in a meeting or trying to sleep, and suddenly, an intense wave of heat washes over you from your chest all the way to your face. Your skin gets flushed, you start sweating, and then just as quickly it's gone, leaving you feeling chilled. It's not just you, it's not just in your head, it's your hormones doing a chaotic little dance. But here's a huge myth I want to bust. Perimenopause doesn't mean your life is over. It doesn't mean you're old. And it definitely doesn't mean you can't get pregnant. Yes, fertility decreases, but it's not zero until you've officially hit menopause, which is defined as 12 consecutive months without a period. So if you're not looking to have more kids, contraception is still super important. The most important thing is to know what's going on with your own body. If you're in your late 30s or 40s and things just feel off, your sleep is a mess, you're more anxious than usual, your periods are unpredictable, it could be perimenopause. Tracking your symptoms and talking to a doctor who really listens is key. This isn't something to just get through. It's a natural major life stage, and understanding it is the first step to navigating it with confidence. You've got this.